Today, let me teach you do's and don'ts for the back pain. Back pain means lumbosacral pain or sciatica. Back pain differs from patient to patient according to the differential diagnosis, according to the different conditions. Back pain mostly can be lumbar spondylitis, can be lumbar spondylosis, intervertebral disc prolapse IVDP, or disc protrusion or disc bulge, most probably L5S1 or L4L5, sometimes L2 L3 L4. These spaces, disc spaces reduce, disc bulge or spondylitis, the bone becomes narrow, or sometimes spondylolisthesis, which is narrowing of the spinal canal and compressing the nerve. Sometimes sciatica, sciatic nerve actually starts from the back and comes down through buttocks, gluteal muscles, then backside of the thighs through hamstring, and in the knee it goes to the lateral side outside, and it branches into two. One is anterior tibial nerve and lateral peroneal nerve. Those two nerves goes all the way through leg, and when it comes to the ankle, it in the foot it branches five branches go, that is called plantar nerves, that's supplying the total foot and the toes. So what happens when sciatic nerve compresses, pain all these along the root of the sciatic this nerve, this is also called as back pain. So this kind of pain, I will teach you do's and don'ts, which is like first do's and don'ts: try to sleep in firm mattress, or try to sleep in the floor, or try to sleep in wooden cot or iron steel cot or any kind of cot which should be flat, straight and hard surface. Try to sleep even wooden cot directly on that, or sometimes use some small like bed sheet or mat. Don't use mattress on that, don't use bed on that. Bed, if you wanted to use bed, it should be a orthopedic mattress and very hard one, the firm one, and maybe for reducing the heat, latex rubber 1 or 2 inches on the top. Like this you can use, but any kind of mattress, even most expensive, can cause pain. Also it produces the heat. Always the mat is far better than mattress. So like this you try to use a firm surface if you are a back pain patient. And the next one, you wanted to get up from the bed, don't get up directly straight, go to one side, keep your hand and bear your body weight to the hand and get up. Don't bear the weight in the spinal cord. Then what happens, you don't do forward bending work for few days, but these all do's and don'ts I will not tell for permanently, until and unless you take sessions from me and do the exercises proper, strengthening the lumbosacral muscles, until and unless you maintain these do's and don'ts. After doing exercise, after strengthening your back muscles, lumbosacral muscles or sciatic nerve course muscles, then you can be normal, like you no need to maintain too much do's and don'ts. And also back pain patients, try not to drive two-wheeler for longer distance. Also try to use very good shock absorber two-wheelers. Also back pain patients can use car. Even the car, if you are driving for 500 kilometers or 1000 kilometers continuously, you may get pain. So try to avoid even four-wheeler drive for a longer for few days until and unless you become reduced pain, until and unless you don't use. And the next one is you walking is good for health, but if you are having sciatica, don't do walking for few days. This all I am not telling to do permanently. Until and unless you get out of the pain, you get out of the symptom, you do this. And walking is good exercise. Also we teach exercise which for back pain, which is non-weight bearing exercise. Walking is weight bearing exercise. Non-weight bearing exercise, most of the exercise for back pain, lying exercise. You lie in the bed and do for hours, even 1 hour, 2 hours, like that. I am teaching like that. So those exercises are also very good for health. That is not only useful for back pain, that is useful for diabetes, that is useful for hypertension, that's very useful for varicose vein. Also foot exercise very useful for the heart, and some exercises, gastrocnemius soleus muscle exercises, that is useful for reducing triglycerides. Like this, that works very well. So we will be teaching that. So don't do walking for lesser time. So like this, there are so much other do's and don'ts. I will tell you in other videos. For free physiotherapy consultation, don't hesitate to call my number. Also, for knowing these kind of tips, follow my channel. And I am Prakash Physiotherapist.